Hi, I'm Dr. Dixon. You're here today to talk about knee replacement, either partial or total. So we're going to go through the risks of the surgery and things that we need to do as a team or make this successful. So on your packet that's been given to you, you have your consent form and some other information, some pre-operative instructions and some post-operative instructions, and also a handout regarding the slope. So I'll be referring to those as we talk. What I've done in your consent form is I've underlined all the risks on the consent form that I think are the most important, because this thing goes a little bit overboard. These risks, talking about strokes, pneumonia, heart attacks, or allergies to anything we give you in the operating room, those are risks with any surgery. The main risk, the one I'm most concerned about, is infection. Why is infection such a big deal? Because the metal and plastic we put inside your knee do not have a blood supply. So if bacteria gets on that metal and plastic, there's no way to get it off unless we do another surgery to wash it out. Sometimes we have to go in there and take all that metal and plastic out of your knee, leave you without a knee for a while until we clear the infection and go back in. It's a big deal. The national average for that to occur is very low, but there are things that we can do as a team in order to decrease these risks. And one of those is to take a shower with an antibacterial soap the night before in the morning surgery. I prefer HibaCleanse. It's a antibacterial soap, surgical grade. You can get that at your pharmacy. I know that CVS and Walgreens carry it. So again, how do you take those showers? The bottle will tell you, but I'm going to tell you as well, and my instruction sheet tells you, but you take a regular shower. Use your regular soap. After you rinse off your regular soap, use the HibaCleanse soap on your rag, a little bit of water to get a lather. Turn off the water to your shower. Go over your whole body except your private areas and your head and neck, and let it sit in your skin with the water off for 3 minutes. After that 3 minutes, turn the water back on, rinse it off, you're done. If you have any cuts, scrapes, any sores in your leg, we will have to postpone the surgery until those heal. Those increase your risk of infection, and we shouldn't take on that risk. I do not want you to shave your leg, your operative leg, for at least 5 days before surgery. That also increases your risk of infection. When you come to the surgery center or the hospital, wherever you're having a surgery, they're going to scrub your knee multiple times with different cleansers. We get back to the operating room, we're going to put the sterile surgical prep on your leg, which actually adheres to your skin. And then we're going to give you some IV antibiotics right for the surgery. And if you plan on going home, we're going to give you another dose of IV antibiotics before you leave. And then you will also get some antibiotics before the surgery by pill form that you're going to take it home. Once you get home, 4 doses, 1 every 6 hours. If you stay the night in the hospital, then we're going to give you the IV antibiotics throughout the night. Even though we take all those steps, there's still that risk of infection. So infection, bleeding. If your blood count is normal, you have a very low risk of having a blood transfusion. We rarely transfuse blood for the surgery. Blood vessel or nerve injury, there are important blood vessels and nerves around your knee that can be injured. We look out for those blood vessels and nerves and protect them. It's a very low incidence for those to get injured nationally. If the artery is injured, then a vascular surgeon will be prepared to take care of it. If a nerve is injured, you could have some weakness in your foot where you cannot bring your foot up towards your face. We'd expect that nerve to recover over time. Some do, some don't. You'll still be able to walk, but you have to wear a brace on your foot. Again, those are very rare occurrences. Pain. I guarantee you, you will have pain after surgery. Pain medications are going to be sent into your pharmacy for you so that you have them prepared before the surgery. But the only way for your pain to go away is for you to get your knee motion back. That means getting that knee always straight and then back all the way. So we heal with scar, right? You get a cut, you get a scar. We know scar tissue is going to form in that knee. We just want it to form in a flexible, pliable manner. That means we need to be moving the knee while it's forming. So scar tissue starts to form the second I sew up the wound, but it starts to adhere inside your knee at 3 weeks. At 6 weeks after surgery, that scar tissue is adhered. Trying to get knee motion back after 6 weeks is not going to happen, so you got to work early to get it back. So most patients get their motion back between 2 and 5 weeks. At that point, the pain is improved compared to what it was before surgery. Not gone, just better. Between 6 weeks and 3 months, you're starting to get back to your regular activities. It takes 1 entire year for the full pain relief to be expected at that knee. And we expect about 90 to 95% pain relief compared to where you are before the surgery. If you don't work through the pain to regain the motion, you'll end up with a stiff, painful knee and be worse than what you have now. So we give you the tools to do it. Physical therapy should be set up and started 2 to 3 days after surgery. I'm going to give you a motion machine called a continuous passive motion machine. It's going to help you move your knee back and forth. It helps to give you mid-motion. about 10 degrees to about 90 degrees. It doesn't get you full extension, doesn't get you full flexion. I'm going to show you the exercises that I want you to do. And I'm going to show you those right now. So these are the two most important exercises, in my opinion, for getting your motion back. So one exercise you're going to do is you're going to bring your leg out in front of you. Bring yourself to the edge of your chair so your thigh's not supported. And we're going to work on extension or straightening of the knee. You're going to push that knee down towards the floor, bring your toes up towards your face, hold it there for 30 seconds, then relax your leg, let it rest there for 30 seconds, and then repeat. And you're going to do this 10 minutes, 6 times a day. That's going to work on straightening or extension. The other exercise you're going to do is you're going to bend your knee as far as you can. You're going to cross your non-operative leg in front of your operative leg, and you're going to bend your knee back using your non-operative leg to push against your ankle, increasing your flexion or bending of the knee. You're going to go back as far as you can, hold it for 30 seconds, then relax. Let it come forward a little bit, let it rest there for 30 seconds, and then repeat. Trying to go back further every single time. Again, holding it for 30 seconds, and then relaxing for 30 seconds. You're going to do this 10 minutes, 6 times a day. Those two exercises are going to get you your full extension or straightening, and your full flexion or bending. Just to repeat, if you don't work through the pain to regain the motion, you'll end up with a stiff, painful knee. It'd be worse than what you have now, and that's not what we want. Blood clots can form your leg up to your lung. If you've had a blood clot before in your past, then you're going to be on a blood thinner for a minimum of 6 weeks after surgery. If you haven't had a blood clot in your past, and there's no family history of blood clots, then we're going to use baby strength aspirin, 81 milligrams, 2 times per day for 30 days. And that's to prevent blood clots. Fracture or break of the bone. Your bone quality may be good, may be bad, but arthritis may increase your risk of fracture by making some weaknesses of the bone. If we see those weaknesses or I cause a crack in your bone, I will take care of it right then. Just like you can fall today onto your knee and break it, you can fall after the surgery and break it. This does not prevent that from happening. Wearing the knee out. We expect this knee to last a long time. Usually what wears out is the plastic insert that goes between the metal components. If that piece of plastic wears out, we take it out and put it in there. The metal can loosen up for the bone. We don't see it happen that often, but if it does happen, we have to replace that portion that does loosen. So by doing this procedure on your knee, you do have risks for any future procedures. So if it were to get infected, if it were to wear out, if it were to break it, fall and break it, we'd have to go back in there and do something else to take care of the problem. So here's your instructions for after surgery. Okay, what I've done is I've highlighted or underlined everything I've written on here for you to see the important aspects. Okay, keep this, put it on your refrigerator, someplace where you can refer to it, because this is important stuff. So one thing, the dressing stays on. It's an antibacterial dressing. It's lined with silver. It's a natural antimicrobial. It's protecting the wound from the bacterial lives on your skin. We want it to stay adhered. It is water resistant. What does water resistant mean? It means you can take your showers just like usual. It is not waterproof, so that means no bathtubs, no jacuzzis, no pools. Don't scrub around the dressing or soak it. We want it to stay adhered. It's an antibacterial dressing, so don't put any lotions near the dressing. If the dressing starts to peel up or loosen, take it off. The last thing we want is water from your shower getting inside the dressing and sitting on the wound. That would cause an infection. We talked about the blood thinners. You're either going to take aspirin or some other blood thinner to prevent you from getting a blood clot after surgery. Once you get home, you're going to restart all your regular medications, all your vitamins, your supplements, your prescription medications. Stocking. So there's going to be a white stocking that goes on your leg. It's called a TED hose. It's going to be mid-thigh. You're going to wear that during the day. Take out for sleep, take out for showers. You're going to get one on your non-operative leg. That's your spare. You don't have to wear that one. Physical therapy. For total knee replacements, you need to start physical therapy 2 to 3 days after surgery. That appointment's already been made. I know that we want you to have a prescription. If you don't have a prescription, then I will make sure you have one before you leave the office. Icing your knee. I can't emphasize the importance of icing your knee. It helps the wound to heal by decreasing the swelling. As long as there's a layer of cloth between you and the ice, you can do it as much as you want. Now, if you put the ice directly against your skin or on your dressing or on the TED hose, that's too thin. It's 10 minutes on, 10 minutes off. On this instruction sheet, I've written down those exercises I just reviewed. Okay, the CPM machine, you're going to do 2 hours twice a day. The knee extension exercise, you're going to do it 10 minutes, 6 times a day. and the knee flexion exercise, again, 10 minutes, 6 times a day. They're all described just like we reviewed a moment ago. Medications. I've written down the medications I'm going to have you take after surgery. I'm going to send those into your pharmacy before the surgery so that you can have them at home, ready to go before the surgery. Okay. I want you to take this instruction sheet to your pharmacy to make sure you get everything. Some of them are over the counter, so you can make sure you pick those up. I hope this information helps you for your recovery, and you're going to do great.